this is a work that we did in conjunction with the American Migraine Foundation, a patient advocacy group. In March 2020, as we know, about 2 years ago, a lot of institutions all of a sudden canceled the elective procedures or clinic visits because of the national emergency of COVID-19. At that time, telemedicine visit was quickly implemented to be used, especially for headache, either new patient visit or subsequent visits. So the goal of this study is to investigate patient experience and patient perspective of how our patients actually think about those telemedicine visits during this COVID-19 pandemic. So we work with the American Migraine Foundation and developed 15 questions and on an electronic questionnaire. So we sent out the questionnaire through different channels, including Facebook or email channels, to reach a lot of migraine patients. And we were able to get 1,172 patients, so about 1,100 patients to respond to the survey and to tell us what they think about telemedicine. So there are several main findings of the study. Overall, more than 50% patients did utilize telemedicine for visit. Most of them used telemedicine for subsequent visit, for follow-up visit, about 85%. About 15% patients used telemedicine for new patient visit. And among those who utilized telemedicine, some were seen by headache specialists, some were seen by general neurologists, some were seen by their primary care or headache nurse practitioners for their headache care during the COVID-19 pandemic. Most of them already had a known diagnosis of migraine before the pandemic. So about more than half of those patients, more than 50% patients, were able to get new treatment prescribed through the telemedicine visit to help with their headache management during the COVID-19 pandemic. So those were some specific numbers. But most importantly, we did ask how satisfied overall would you rate this telemedicine visit? And about 83% patients said they rate the experience as either good or very good throughout the pandemic. So I think that is very reassuring. We also asked them whether they would like to continue to use telemedicine during and even after the pandemic. And around 90% patients said yes, they would like to continue to utilize telemedicine going forward. And some patients said maybe yes, but not for all visits. But reassuringly, I think it was very positively, 90% patients said they would continue to utilize telemedicine going forward. So I think that align with our clinical experience as well, because when we are seeing patients in the clinic, a lot of patients, they enjoyed doing follow-up visits through telemedicine, and they feel like that's something that they would like to continue as well.